Hi, my name is Viva Artist. Today, nandito tayo sa CSA para may aayusin ulit si Doc sa face ko. Pero bago yon, gusto ko lang i-share yung mga naging procedures sa akin before, nung mga bago-bago pala ako nag-visit dito. So yung first na ginawa ni Doc sa akin is yung nose ko, pero super minimal lang nung enhancement. Ayun, pinataas lang niya ng super slight yung tip ng nose ko. Tapos yung pangalawa naman is yung jaw ko. Binigyan niya ng onting fillers para mas defined sa screen, ayan, pagka may mga shows ako. And for today, ang gagawin sa akin is ililift ni Doc yung face ko. So, ayun. Na-excite ako sa magiging results. So, don't forget to like and subscribe.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a topic on the male face contouring as well as acne scar management. Before that, let's all welcome back Sam Manalo.
Hi! Hello po. Hello.
What's up, Sam? What's new?
Same.
Yeah, same.
Yeah.
So we did a procedure for some on the jawline area. We made use of some of our dermal fillers, hyaluronic acid. So how was it after that procedure when we did those injections here?
Mas naging confident akong mag-side view, actually.
Yeah, because even the other clients that we have, when we do this jawline filler here, they notice a great improvement, particularly on the angle of the mandible. And in addition to that, actually apart from highlighting features of the face or beautifying, we also use this treatment for anti-aging or prevention of aging, because as we age, I've explained in the previous episodes, the mandible, the jawbone, will age, it will shorten. There's a kind of bone resorption. So when it shortens, so the tissues on top of it, they become loose or saggy. Then you'll develop some jowls here, and the others will develop this under chin kind of sagginess or loose tissues here. So it's also prevention of aging or anti-aging na rin. So, ilang taon na ba si Sam? Balita ka, malapit ng birthday. Happy birthday!
This December.
Right. So, turning 23. Yan. So, at this age, we can do some treatments already on like improving features of the face, creating that good angle there. Right now, we'll still add something for that. Okay, so we want also features on the lower face whereby there will be like a symmetry and balance. We want to make the left and right symmetrical, balance. Yan, pantay, right? And also, I'm checking on some of the baby fats. Meron pang baby fats. So, we want to also kind of reduce some of that fats, particularly on the lower third of the face or lower cheek area. So, we want that to be reduced. Siyempre, a little percentage lang, hindi naman lahat. But we want also to be within that right male contour of the face. So, di ba yung iba nakikita mo parang talagang masculine, and then yun, robust yung jawline, plus walang mga nagsasag na mga laman-laman here, or walang masyadong cheek fats or cheek yun, projection na masyado, especially for men. Kasi women, we want that good cheek projection, or we want that high cheeks. Sa mga lalaki naman, hindi naman siguro babagay yung high cheeks, di ba? Yan. And hindi rin babagay siguro yung may sobra kayong bulge here. So just doing a treatment whereby we want to minimize that, and then still we'll add on something for the sides, the angle, plus we'll manage the concern of some here, the acne scars, souvenirs from your pimples.
Yes.
Right? And also reduce some of the inflamed acne and improve the texture, the quality of the skin. What treatment, what procedure, we'll show you when we return. we're back. We're with Sam here. A while ago, I was mentioning to Sam, Asian face actually is round shape face. Kaya I've mentioned to Sam, baby face ka pa, bilog, round. Although, genetically speaking, we're really known for having a round, wide, short face in Asia. So, what we want to achieve right now, for a masculine face, actually men would want to have like a square shape. Women, we want that kind of like a V contour or like an oval shape, a rounded oval shape. So for Sir Sam, so we still wanna improve the jawline contour here, plus also reduce a little bit some of the fats on the particularly lower part of our face. So for that one, what we're going to do is a treatment we call face mesotherapy using our lipolytic solution. So here in our center, we use the so-called minus solution. So it has some contents that are targeting the fat layer and gradually dissolving those fatty tissues. Okay, so Samuel actually had a treatment of that, like you did it before, and he mentioned that there was some reduction already. Because with face mesotherapy, we do it in session. So we'll work here, right side first. So kindly spray. So we'll target the jowl fats, the nasolabial fats, and also our so-called malar fat pads there, okay? So I'll be using this lipolytic solution and we inject it in the fatty layer or subcutaneous layer. So I'll work on the so-called jowl fat here. My technique is more of the so-called fanning technique. So just a small push of our product there. As to the number of solutions or how many cc per treatment area, you can start with like 1 cc per treatment area, and it will depend on how thick the fat volume is. Sometimes like in one area I use 2 ml to 3 ml. So depending on the problem, depending on the volume of the fat. So this part here, actually we have a deep fat pad, the buccal fat. Yeah. So actually masarap kumain, no? Sam?
Yeah.
And in some people, when they eat a lot, fat accumulate on the face area. And some people naman, body area. Some people who try to lose weight, they were noticing that their body might reduce some of those fat tissues, but they notice on their face, naiiwan yung mukha. Like the face is still kind of, still has those fat volume. So I'm working on this nasolabial fat now and then going to the cheek fat pad. Okay. So this is on the right. Then later on, we'll also add on the submental region or under our chin. Okay. Our next treatment will be the so-called Newton Cog Lift. So we'll have a design whereby I will have a vertical line here. So starting from this temple region on the posterior aspect near the hairline, and then after that following the mandibular border here. So it's kind of like an L shape or like a right angle here, just to create that good angle of the, particularly this part of the mandible here. So I have a lidocaine here. It's actually tumescent solution. So I'll just inject in my entry point, and I'm using a gauge 30 long needle, and then we'll just direct it into this line. So we'll follow the track of our thread. So we'll just push our tumescent anesthesia here. So it's a mix of your lidocaine with epinephrine and your saline and also your sodium bicarbonate. So I'll be needing more. So our PDO threads actually can help in reducing fats 20 to 25%. So they did a study on that one. They reported that the polydioxanone can help in fat reduction from 20 to 25%. So for those individuals with concerns of like too much of fats on their face, PDO thread lifting is a good treatment for like contouring as well as lifting any saggy areas and even your so-called collagen stimulation. So I can now create my entry point here. There you go. So this is my entry point. Okay, just a tiny prick with a gauge 19. Okay, just being gentle there. And I'll use this spiral cog, Newton cog, with a cannula, gauge 19 cannula, or even your 21 gauge cannula. Okay, just gliding it here. So we'll add some more lidocaine. And the cannula is actually 100 millimeters in length, or 10 centimeters in length, while your PDO cog thread is longer. So usually the PDO cog thread is in a 180 millimeter length. So it's loaded inside this cannula here. So just a lidocaine for some here. I do understand that the pricking is not a comfortable treatment. You can do your pain freeze in the area. So spray your cryo anesthetics, yeah, and then we'll just glide this part here. So it's actually in the layer 2. We want the subcutaneous, the yellow part, to be the layer where we will lodge our Newton cog thread. So this is an area whereby we have a lot of like tissue fibrosis, this lateral part of our face, especially if there is like conditions with acne scars. So it's normal that you have some tissue resistance to it. And we're already on the inferior border of the mandible. Then we just press on this and pull it out. So we want our barb or cogs to lodge in the soft tissues. Then we'll just proceed to the angle of the mandible. So we did some injection of lidocaine a while ago, an entry point here, and we'll just glide and follow this mandibular line. So you want your material in the so-called subcutaneous layer or layer 2. Then we'll do the last one, your second entry point, at least a cm above that. And then after this, we'll also combine the treatment with acne scar management with our device called Eladerm radiofrequency microneedling that treats those acne marks. So even for cases of acne lesions and also some inflamed acne there, we can use our radiofrequency microneedling device to treat also those active acne. So I'm just cutting the strand, remaining strand here, and also here. There you go. So let's just proceed to the left side. So we have done the lipolytic treatment together with the Newton cog for the sides of the face and the jawline area. So it's like an L shape there. Now we'll do acne scar management. So we'll work on the full face, and we have our device, the Eladerm radiofrequency microneedling device. So this is indicated for acne scars or those with active acne lesions, also like those with fine lines and wrinkles or any concerns of skin laxity, sagginess, or droopiness on the skin. So we'll work on the upper part first, the forehead area. Even large pores, even oily skin, even skin with concerns of redness or inflammation, we can use this device. Okay, so I'll just start on the upper part, our forehead area. Okay, so this one also has a cryo spray.
Yeah.
So that one is a cold spray to numb the skin as well, so that you don't feel the micro pins, because it has this has 25 micro pins. Okay, so I'll be stretching the skin like this. So we'll just treat the forehead area. So microneedles, 25. And at the tip of the microneedle, we have the RF energy delivered in the reticular dermis. And that energy will help in fibroblast activation as well as neocollagenesis. Okay, then we'll do this part here. So those with concerns of this acne scars, enlarged pores, some of the fine lines and wrinkles, or even static wrinkles, this is a good remedy for them. Even for women with concerns of like stretch marks or some concerns on their skin like laxity, body areas, we can use this device to treat those concerns. Even the so-called hyperhidrosis, this has been used already for those excessive sweating in axilla, some palms, and soles of the feet. So we will now proceed with the temple area. This one. So the temple region, we shouldn't neglect this because we also have some acne marks here. I noticed for men, they have a lot of like acne marks also on the temple region. And acne problems tend to be more severe with men because of the androgen hormones. So, pag maraming androgen, testosterone, dihydrotestosterone, kind of like predisposing you to this problem of acne, and with acne inflamed type leading to acne scars. Yan. Kayang-kaya na ni Sam to. Maliliit na needles na. Actually, the micropins, microneedles, they can reach a depth of like up to 3.5 millimeter. So you can start from 0.5 and the deepest could be 3.5 millimeter. So usually the minimum depth we use is like 0.8 around eye area. Then forehead area you can use 1 to 1.5 plus the nasal area. And when you work on the mid face and lower face, you can use a 2 millimeter, 2.5, 3 millimeters, even up to, like in body areas, you can use the 3 to 3.5 millimeter depth. Still good?
Yeah.
Yeah. No pain, no gain, Sam. Yeah.
Oh.
You understand. Sam needs to like have a skin that's gonna be clear and really that free of scars, free of acne, free of like skin irregularities or skin imperfections, because you're an artist. You face the camera.
Oh.
And ang camera pa naman, they can magnify the face. They can see the pores.
Yeah.
Especially now applying a skin booster for faster healing, plus it will help in the skin's rejuvenation, and it contains all those skin micronutrients, amino acids, peptides, vitamins, and minerals, plus some growth factor peptides to rejuvenate the skin as well as improve skin texture and skin quality, and will help in the accelerated recovery of the skin. Then finally, the chin area. Then after this, we'll still apply soothing gel, and we'll also add some so-called modeling mask and also a low-level light therapy with our Healite. Then we'll show the result to Sam when we return. And we're back. So let's show the result to Sam. So Sam, it's normal that we have redness or erythema after the radiofrequency microneedling. That's actually the end point every time we do radiofrequency microneedling. Then actually after this, we will still do the light, a low-level light therapy. Then the redness will go away once we have done that light. Yan. So, what's the feeling, Sir Sam? Are you okay?
Yeah, goods lang.
Yeah, okay lang because like I've been mentioning to some, okay, no pain, no gain, okay?
Yeah.
So, after like devices or this kind of radiofrequency microneedling, it's expected that the skin will have this some temporary redness. Especially some is prone to this kind of redness. I noticed that his skin is kind of like hypervascularized and like siguro under the sun, when you're exposed under the sun, you'll easily get redness or you're upset. Yan. So you'll have like your cheeks are already blushing or meron siyang tinatawag na facial flushing. So kind of like rosacea skin as well. Or like if you're taking some medications that make your skin prone to redness, like for example, vitamin A capsules or isotretinoin, your skin is so red. Or you drink alcoholic beverages, your skin is so red. So something like that. But in a little while, it's gonna go away, especially when we do our light treatment. And actually, I added a so-called, a little bit of a Jotox. Because I like palpated the masseter muscle. It's kind of strong. So we just wanted to kind of reduce it a bit. So I just used like 20 units, that's it. To still kind of get rid of the too much bulging on the gonial area or the angle of the mandible there. To bring out that good contour, that masculine angle of the jaw or the mandible. Yan! Yan, mandible, man. Yun. And then the Eladerm, okay, so we targeted the acne marks, acne scars, and we need to do this in sessions. And usually, like, there's an interval of like every 4 weeks. Some of our cases, we have done some cases like every 2 weeks. It will depend on the problem, on the skin condition. So for some, because he has this erythema or like rosacea, we could do this like once a month for his case. And some cases will need 3 sessions, some will need 5 sessions or more, depending on the severity of the problem and depending on how your skin will respond to the treatment. Some people have faster healing, some people respond like better, or some people are slow responders. Like there's no good quality of skin, or some people might be deficient with certain like micronutrients, or like the older we are, the slower the healing is. Yeah. So the contour, the jawline area, and also the sides of the face, we still want to wait for an outcome for that one. The threads that we place, and also the fat dissolve, we give it like 2 to 4 weeks, and then we check again if we still need to add more lipolytic solutions. Okay? Okay, Sam, thank you so much.
Thank you din po.
Yan. So we'll follow you. Ano na kasi ang social media account mo?
Saul Manalo. Ayan,
Right.
Saul Manalo. Yan lang po.
Correct.
Sa lahat.
Yan. Kami rin, our social media, Facebook, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. If you have any questions, you may email us at csaskinclinic@yahoo.com. Our clinic is located here at the Infinity Shop, Pulong Maragol, Angeles City. Contact number 0933-860-9190 or 0917-504-4268. And please do watch our other episodes, the videos that we had with Sam. Ilang video na ba tayo?
Parang dalawa.
Yeah, there you
Tapos
go.
pangatlo to.
Right. So please check on his previous videos and let's see what was the original look of Sam, okay? And we'll show some photos, even your photos like a week after or 2 weeks after, we'll share it with them. Okay, thank you, Sam.
Thank you po.
Advance happy birthday.
Thank you po.
Okay, so God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.